Good morning, everyone. I'm Richa Sehra, founder and editor-in-chief, Responsible Hospitals, and today I would like to welcome all of you on our Insta Live session. As you all know that I always come up with a different kind of session in terms of topics, subjects, and what people really want to hear it. So today I'm going to talk about something which is very common in men, but nobody actually comes out openly to talk about it. So why not to pick up such kind of topics which are very important and people really want to hear it. So today I would have Dr. Paras Saini with me. He's an infertility specialist and a consultant urologist from Hoshiarpur, Punjab, and he'll be talking about these issues in depth. So we'll be talking about the prostate gland issues in men in very common. So I'll be just adding him ASAP and we will start the session soon. So team, if you can just try to connect me with him. Let me also try it myself. Dr. Paras, can you listen to me? Can you hear me? I've just sent you a request. You need to accept it and then we can start immediately. So guys, in case you are also one of those, you would know a number of people who have such kind of issues, but they are not very open to talk about it. I think this is the right platform wherein we can talk and we can start the mutual interaction with the doctor and can ask a number of questions as well. So Dr. Paras, I've just sent you a request. In case you haven't received, I'll just do it again for you. Yeah. So I've just sent it, accepted, and we can immediately start the session. So guys, today's session is more about, good morning, Dr. Paras. How are you doing?
Good morning, ma'am. Ma'am, fine, ma'am.
Great to hear from you. It's pleasure being with you on this session. And,
Thank you, ma'am.
great. So, Dr. Paras, since you know that we're going to talk about the prostate gland issues today, and this is a very common problem in most of the men, but it is not a very openable topic where people talk about it. So I
Yeah,
think today is the day where we will talk about it. First of all, tell us, what is prostate issues? What is it exactly? What is this term?
ma'am. Prostate is a gland which is found only in males, and ma'am, its main function is to produce secretions that is mixed with the secretions of the testicles and to keep our sperm healthy, and also it has another function to milk our urethra so that our urine passes very well.
Okay. Okay. So, doctor, I mean, how is it important? I mean, is it because it is something which is very common in men, but nobody opens up? What do you think? What is the reason for it? Why people are not so open up about these issues?
Because ma'am, most of the people's does not know what are the signs symptoms of the dysfunction of the prostate gland first, and second ma'am, because Indian society is a very closed society, and they don't want to open up even for their diseases. So these are the
Right.
two main issues, and most and the most important thing is that most of the people does not know that their prostate gland is getting diseased or getting infected, so they thought ki just it's a normal thing, and they keep on delaying the things.
Okay. So, what are the common prostate issues basically?
Ma'am, prostate issues are we
I mean, what
generally
are the problems regarding that?
yeah ma'am. So a prostate issue first ma'am, in young males it is called infection of the prostate, which is called prostatitis, which is very common because of the infection in the urine. And once the infected urine passes through the our urethra, urinary passage, some of the urine goes inside the prostate and cause infection inside it. So main problem, patient feel that discomfort which they are not able to localize where is discomfort, just they have suprapubic discomfort. Second, their urinary stream is slow down, they have to apply force to keep the urine out. So these are the symptoms in young male. And another most important symptom is infertility. So sometimes prostatitis infection is so common and it is a cause of infection to our sperm, and it may cause the infertility problems in young males. Whereas in older people, most of the prostatic issues are related to the urinary stream. Their urinary stream before is very good, now it is keep on slowing and slowing. They have to apply force to keep their urine stream good. And third most important is the cancer symptom. The most important thing in cancer syndrome is that it is mostly asymptomatic. Most of the patient does not know that they have a cancers of the prostate. So they do just, in my opinion, every male after 55 years of age should consult a urologist at some point of time to get examined about the prostate.
Sure. So you're saying it is very common, but people are not even aware that they have this kind of issue.
Yeah, ma'am.
Okay, okay. So, is there any age criteria wherein we find that this is the kind of age people would definitely must be going through with this kind of issues, but they are hiding it?
Yes,
Any
ma'am.
age
Most of
specific?
the Ma'am, prostate is generally a aged phenomena. Every male, after some time, after 50 to 60 years of the age, their prostate generally get enlarged. Sometimes enlarged prostate give problems, sometimes it does not give problems. So
Okay.
prostate is a main aging process, which is very natural. But when it gives problems, there is lot of issues with it. Urinary stream slowing down. Then, ma'am, we have urinary tract infections. Our urine get infected. So these are the age-related male phenomena. Whereas in young male, they have chronic prostatitis, and most of our patients have a chronic prostatitis. That's a discomfort, itching, slowing of the stream at a very young age, and they are not able to define it ki how it is happening, and it is just because of the infection in the urine that is causing the prostatic issues.
Okay, okay, okay. So this is how they get it, that if they find any problem passing urine or forceful
Yeah.
effect, so they find there is a problem, maybe a urine infection,
Yeah, ma'am.
and then they consult the urologist.
Yes, ma'am.
Right. Somebody has asked that how elderly people can get over their prostate issues.
Sorry, ma'am.
Somebody is asking that how elderly people can get over their prostate issues. So in case somebody who is elder and
Ma'am,
gets it, how do we how does he get over it?
ma'am, first I will suggest that every elderly male after 55 years of age at least once visit a urologist and get some information about the health related to the prostate. Because, ma'am,
Mhm.
once we have a knowledge, then we can act upon. If patient does not know, they don't act upon it. So first elderly male having a good urinary stream, but now they realize they have to be delay their stream. When they go for urination, they have to wait for a minute or two to start their urinary stream. These are the generally first symptoms. Then they have got recurrent urinary tract infections, fevers, and ma'am, then they have to apply lot of strain to get the urine out. So these are the symptoms which a elderly male is looking after to have a prostatic examination, ma'am.
Sure. Somebody has asked that drinking more water is also good for prostate.
Ma'am, drinking more water, as a urologist, I will suggest that a normal range of water is more important than drinking a lot of water. Ideally, we should at least drink so much of the water that we get a urine about 2 liters, because it is only the urine output that matters, and what amount of water we are drinking, it does not matter to us. Normally, we suggest not to drink lot of water at once. Drink small amount of water at frequent intervals, which is more beneficial. And if ma'am our urine output is good, it is getting empty at regular intervals, so there is very less chance that prostate get infected. So definitely drinking water is a very good habit to keep our prostatic tissue healthy.
Sure. And doctor, is this disease, I would say, is it age specific कि इसी एज में हो सकता है या some people say नहीं मेरा तो age is not like कि इसमें भी हो
Ma'am,
सकता है लेकिन
what we have learned and what our respected teacher has told us, that prostate size does not matter at all. It is the symptoms that matters, and no age is immune to the prostate issue. But and only generally it is a issue when person crosses the age of 55 years, not before. Before that we don't operate upon prostate or do anything, ma'am.
And do you think people who already have these kind of issues like prostate issues, in case they do not go to doctor on time, they do not see them, do they get more issues? Can they get more infections? What could be the result out of it?
Ma'am, first, when a patient has a prostatic issue and they keep on delaying it, there is a lot of urine that get remained inside the bladder, and remaining urine inside the bladder causes infection in the urine, and that infection goes again and again, causing fever, causing severe sepsis. Even some of the patients end up in ICU because of the urosepsis, severe infection. Second thing, ma'am, our bladder get damaged because bladder has to apply lot of force to get that prostate, overcome the prostate. So over a period of time, our bladder tone is also lost. So even if we operate upon that kind of patient, their flow rate does not get improved because, ma'am, our bladder is getting damaged because it has to work overworked to get the prostate issue. And the most deadliest complication is that, ma'am, our kidneys upstreams is also getting infected. When they are getting infected, they are getting enlarged, then these are our kidneys start rising, and patient may end up in a renal failure also.
Sure. And doctor, so when do you think that they should see the doctor? What is the time? What is the signal they get? Now, it's too much. I've already waited for these many days. So now I need to really see the doctor.
Ma'am, through your media, I will request each and everybody, don't wait for symptoms. Just consult urologist for knowledge about the prostate first.
Okay.
And second, and the most important thing is symptoms. When they see that their urinary stream is getting slowed down, they getting again and again infections, they get again and again fever with chills and rigors. So they should see a urologist at that point of time only, without any delay, before it getting too late.
So how do doctors treat prostate issues? What are the treatments available?
Ma'am, first and foremost, our age related. If a patient is 55 and above and he get these type of symptom, obstructive type of symptom, the urinary stream is slow down. First and foremost, we never advise surgery. First, we go for medical management. We prescribe medicines to relieve our prostate of its tension. Some of the patient, even most of the patient, getting relieved only of a medication. Then and if patient does not have again and again urinary tract infection, then we will continue with the medical management only with the medicines. And if that strategy fails, even after putting on medicines, patient getting recurrent infections or upstream kidneys are getting damaged, then we have to be operate that prostate, ma'am.
Sure. So these are the basically sequence of the treatment, right?
Ji, ma'am.
Sure. And how one can actually prevent prostate issues? Any tips on the lifestyle, diet?
Ma'am, again for prevention, knowledge is the best tip, to have some knowledge of urinary tract infections, stream, how prostate getting healthy. Second, we prostate, because it produces lot of secretion, so prostate need lot of antioxidants in it. So patient has to take a lot of healthy food which is rich in antioxidants, like our fruits, especially cherries, which are very good antioxidants. So, and a lot of amount of water that is sufficient to prevent infections. And second, never delay the symptoms is the most important tip for the prostate issue.
Sure. So my last question to you is that, when a person is lining up in the surgery, so they already have a number of points and questions in their mind, saying that, what could be the after effects, side effects of surgery, how does it happen, how much time does it take, what all they need to take care. So just tell us about the surgical process also.
Ma'am, in the surgery, first and foremost, we explain the patient that it is a surgery related to prostate, but the results of the surgery depend upon the condition of the bladder backwards. If bladder is healthy, if bladder does not get is not damaged so much, so results are very good. And surgery generally, ma'am, nowadays endoscopic surgeries are nowadays preferred. Nobody generally we do not operate upon with the open method. We
Okay.
generally do that. We generally do with a resectoscope, TURP, and if patient is on any blood thinner or anything else, then we opt for a laser surgery. Laser surgery is nowadays is upcoming, and but
Mm-hmm.
still the gold standard is through our resectoscope, through our endoscopy. And normally we operate for 45 to 1 hour, which is the safest limit. Then we keep the patient for 2 or 3 days and then discharge the patient. Patient has a good steam. We follow up patient with our again investigations, and we keep on following the patient for a month. Then we leave the patient if patient has a satisfactory steam.
So they get back to the same normal shape after having a discharge. They can walk themselves. They are independent.
Yeah, ma'am. This is the only method of getting back to the normalcy. For after operation, we generally advise the patient to check on the flow of the steam, and if they are satisfactory steam like it is beforehand, then it is considered a good surgery and patient get back to normalcy, ma'am.
Sure. One somebody asked that, are prostate issues common?
Yeah, my prostate issues are very common now, but my focus nowadays are younger population because younger population nowadays getting lot of prostatic issue and they are very
Yes.
shy. Ma'am, they don't
Right.
know what are the symptoms at the young age because in the young age surgery is not an option. So, ma'am,
Mm-hmm.
they have to be improve on their habits of not to drink, not to smoke, and take lot of antioxidant fruits and have a healthy lifestyle. So reducing weight is one of the tips to having a healthy prostate at the younger age.
Sure. Somebody is asking, do a large prostate affect men sexually?
Yeah, my prostate is always associated with our sexual life. Ma'am, large prostate and obstructive prostate causing sperms not to discharge forward, it getting discharged backward. And after prostatic surgery, through a resectoscope, we always explain the patient that there is every chance of retrograde ejaculation, that patient may feel some problems in discharge, but otherwise no problem. Only problem is with the discharge.
Okay. Sure. Any home remedies to fight prostate?
Meant lot of antioxidant foods, lot of which contain lycopenes, our apples, our cherries, especially the cranberries. Cranberries is not so common in India, but
Yeah.
even for prostatic diseases, ma'am, we prescribe lot of cranberries extract. So if a patient is able to take berries, it is very good, ma'am. It is very good for our prostate.
Sure. And then somebody is asking, how prostate pain extreme?
How for prostate?
Pain. So there, do you think there is a prostate pain which is too much?
Ma'am, uh, I likely to discuss this issue because, ma'am, prostate at very young age, which I commonly call as chronic prostatitis, the pain is so severe and the quality of life is so compromised that patient tried many doctors, many remedies, but there is actually no relief from the prostatic pain. So my advice to keep prostate tissue healthy is the best way to land up in chronic prostatitis at a very young age. Ma'am, it is so severe pain and so discomfort that patients are completely occupied with the pain issues and they have to try a lot of things, but they did not get any relief it. So keeping the
Sure.
prostate healthy is the only way.
So they need to visit to the urologist, right? Because some people
Yeah,
are
ma'am.
not even aware where to go and who to see. That's the major important part.
Yes, ma'am.
Right. Thank you so much, Dr. Paras. I think it was quite informative for people because this is a small thing, but then such a big disease also. So a lot of people are hiding and they're not open about it. So I always thought to talk about it in certain. So thank you so much for being with us. It was a great
Thank you, ma'am.
session.
Thank you.
Thanks so much.